Healthcare isn't a static thing, it's a frontier, always pushing forward, always changing. Every single day, researchers are out there testing the limits of what we thought was possible. So today, let's dive right in and explore 5 of the most exciting, most groundbreaking frontiers in medicine right now. So what are the big mountains that researchers are trying to climb? From the way our hearts beat to the way our minds work, and from a single hospital bed all the way out into our communities. The answers are completely redefining what it even means to be healthy.
All right, so here's our roadmap. We're going to start with something straight out of science fiction, AI as your future doctor. Then we'll get back to basics with nutrition as a powerful form of medicine. After that, we'll connect the dots between our minds and our performance, tackle the huge problem of chronic pain, and finally, look at how prevention is becoming the new frontline.
First up, let's talk about AI. And yeah, I'm posing a serious question here. Could your future doctor actually be an algorithm? We're going to zero in on how this tech is being used to fight one of the biggest killers out there, cardiovascular disease. What we're seeing here is a massive shift in how we approach things. Traditionally, diagnosing heart disease depends on a doctor's skilled eye, but that can take time. But as Dr. Vandana Dahiya's research shows, AI is a total game changer. It can crunch these enormous, complex data sets and give us predictive insights. We're moving from just reacting to problems to actually predicting them. So, how in the world does it work? Well, it's basically a 3-step dance. First, the AI gathers up all the data it can find, your clinical records, medical scans, even the info from your fitness tracker. Then it uses machine and deep learning to spot patterns a human doctor might just miss. And here's the magic part. It predicts risk. It can flag these tiny, subtle changes that signal a problem is on the horizon long before you'd ever feel a single symptom. Okay, from super advanced algorithms, our second frontier brings us right back to something incredibly fundamental, nutrition as medicine. It's becoming clearer and clearer that what we put into our bodies can literally transform how we heal. Think about it. After a major surgery, the recovery is where the real work begins. Dr. Pushpa B's study points out some super powerful nutritional tools that often get overlooked. We're talking about specific protein supplements to rebuild tissue, making sure micronutrients, vitamins and minerals, are perfectly optimized, and this really cool concept called immunonutrition, which is basically using targeted nutrients to supercharge the immune system right when it's most vulnerable. And when you give patients this kind of personalized nutrition, the results are, well, they're not just small improvements, they're dramatic. You see wound healing speed up. The risk of getting a nasty infection drops way down. And because of all that, patients get to go home and get back to their lives so much faster. It's proof that food isn't just fuel, it's a critical part of the clinical toolkit. All right, for our third frontier, we're making a big shift from the body to the brain. We're going to explore this incredibly important connection between our mental well-being and our ability to perform and succeed. Now, Dr. V.R. Scheinbach's work really centers on this idea of mental health awareness. And let's be clear, this is more than just saying mental health is important. It's about the deep down knowledge, attitudes, and beliefs that shape how we see it. For students especially, who are under just immense pressure, this kind of awareness is that critical first step to recognizing there's a problem and actually reaching out for help. So, what was the big takeaway from the research? Something crystal clear: a direct positive connection. The more aware students were about mental health, the better they did academically. It's a powerful signal that supporting students' mental well-being isn't just a nice thing to do, it's absolutely essential for their success. Our fourth frontier takes on a challenge that affects millions and millions of people: chronic pain. And what's really fascinating here is how the solution seems to be this blend of old-school approaches and brand-new tech in physiotherapy. So Dr. Kalindi research kind of puts 2 different toolkits side by side. In one corner, you've got the traditional methods we're probably all familiar with, hands-on therapy, stretching, water therapy. And in the other corner, you have these modern tech-driven techniques like TENS units, ultrasound, and even using virtual reality to manage pain. So, the big question is, which one's better? Well, it's not that simple. Turns out the modern stuff often gets you quicker results, and patients tend to be happier with it right away. But here's the catch. The traditional methods, while slower, often lead to more sustainable, long-term relief, and they're way more accessible to more people. So clearly, neither one is the perfect answer all by itself. And that leads us to the study's really powerful conclusion. The best strategy isn't choosing sides. It's about integration. It's about combining the fast relief you get from modern tech with the lasting benefits of traditional therapy. That's how you get the best possible outcome for the person in pain.
And for our fifth and final frontier, we're going to zoom all the way out. We're going from treating one person at a time to protecting entire communities. This is all about prevention in the community, a truly proactive way of thinking about global health. The big focus here is on something called non-communicable diseases, or NCDs. Now, as Dr. Suresh Kumar Vajpayee-Mavati's research shows, these aren't like the flu. You can't catch them. They're chronic conditions, think heart disease, diabetes, certain cancers, that have quietly become the #1 cause of death around the world, hitting rural communities with less healthcare access especially hard.
So how do we possibly fight something that big? Well, the solution isn't just one magic bullet. It's a 4-part strategy right at the community level. You start with health education, giving people the power of knowledge. You add in regular screenings to catch things early. You provide nutritional guidance to make healthy eating the easy choice. And you support people in making lifestyle changes, like getting more active. It's really about building a culture of health from the ground up. So when you step back and look at all 5 of these frontiers together, you start to see this incredible picture of what the future of health looks like. It's not any one of these things alone. It's all of them working together. It's a holistic approach, right? Using high-tech AI for diagnosis, but grounding it in foundational care like nutrition. Prioritizing our mental well-being just as much as our physical health. Integrating the best of old and new treatments for pain, and building it all on a massive foundation of proactive prevention. And that brings us to the final and, honestly, maybe the most important question of all. We've seen 5 incredible areas of progress. But as our medicine gets smarter, as our technology gets more powerful, the real challenge becomes a human one. How do we make sure that these amazing innovations actually benefit everyone, everywhere? Now that is the next frontier that we all have to figure out together.